We're about to begin. Pardon me. So, just want to make sure that everyone is hearing. So, and I'll just put up my pretty face. So, if you're not hearing me, I'd like to ask for you to just let me know by putting it in the comments. If you're hearing me okay, then great. We're about to get started. Is this any better, Anne? Besides, the music will stop once we get started. I just want to have something filling the airspace. But can you let me know? Okay, everyone. Good evening. I'm hopeful that you're all hearing me clearly. Let me just organize myself here. Just 1 second here. Just want to make sure that everything looks in good order. Okay, so let us get started. Um, the topic for tonight is the 7 keys to getting and staying well. And so, as a part of what we would like to do, we wanted to make sure that every opportunity that we get to share information that can help our patient population, but the general public at large, to get info that will help them to make wiser choices for themselves and for their families. So I say for yourselves and for your families. And if we don't have a proper appreciation for what it will take to be well and get well, then we will make poor choices and we will continue to make poor choices in life as it relates to our health. There's a lot that's happening right now in the world as it pertains to this current state of affairs with what's happening in healthcare internationally. I don't think I need to say the name. I'm sure you hear the name more than enough on the news. But with all of what's happening, there's a lot of uncertainty, a lot of speculation. Some things make sense, some things don't really make a lot of sense to those who are really scrutinizing and observing what's going on. But one thing's for sure is that we are being given a steady dose of fear in the public sphere. And I think that's problematic. It's problematic on several levels. The most fundamental level that makes this problematic is that we are incapable of making, or the capacity that we have to make a sound decision when we are in a fear based mode goes down. Things that we will do when we are calm and at rest and are able to think clearly, we probably will not do if we're in a fear based environment. And so, when persons try to motivate us to act based on fear, I have a significant problem with that because most of these persons who use marketing tools to instill fear in people, they already understand how fear impacts our ability to make a sound decision, which says to me that they do not want us to make a sound decision. And I say they very loosely without trying to specify any group of persons. But be that as it may, we are here. And so the biggest way that we can dispel fear from our lives is with knowledge. The Bible says perfect love drives out all fear, but perfect knowledge reduces our likelihood to be fearful. And so, even for me, for example, I have the blessing of having had significant training in reading research, in even conducting research myself, to understand what the research, um, I don't want to say environment, but the research community has to say about what's going on. And believe me, it's very different from what you hear on the news. So I don't want to get too much into that per se. I want us to understand that the reason that we are doing this here for you is to make sure that you understand more about your health, more about healthcare, more about your bodies, so that you can make a wise choice, an informed choice, and a good educated choice. Because the better choice that we can make for ourselves and our families is the better likelihood we have of maintaining optimal health and wellness. So I'm going to just ask for your indulgence just for 1 second. I'm going to do something really quickly, and I'm just going to switch back screens here for a second. And let us start to discuss the 7 keys to getting and staying well. So give me one. Okay. So we're looking at the 7 keys to getting and staying well. And I want you to participate. I'm going to be asking questions and I want you to participate. And just as an administrative issue, I'm going to ask that if you are listening, that you indicate your name in the chat so that we know who you are, so that we can use that as a register, because at the end we have a special offer and I want everyone to be able to access that offer. So here we go. The topic: 7 keys to getting and staying well. The first key is understanding the difference between sick care and healthcare. And when I say healthcare, I mean true healthcare, where we're trying to cater for the optimal health of the population versus treating people who are sick. It's two different things. And if we don't understand that they're two different things, we're gonna make, we're gonna be disappointed when we approach the healthcare system for any kind of intervention. So as we look into it, when persons are sick, they end up going to a doctor, going to a hospital, or whatever the case is, depending on the level of severity or urgency, and they will get some intervention. Now, this intervention that is given will serve one of two primary purposes. One is to save the person's life. Two is to ease their suffering. And that, you find, is the primary objective, or are the primary objectives of the healthcare system as we understand it to be. But really, this system is not about helping people to achieve or attain optimal health. It's about saving their lives, making sure that people don't die. And if it's not life or death, but somebody is in a lot of pain or having distress because of some symptom, is to try to ameliorate these symptoms so that they can have a more comfortable existence, right? So those are the two primary things, and they're very important roles to have played. So I don't want anyone to think for a minute that we're saying that the healthcare system is bad because that's the focus. You have to understand that with limited resources, you can't focus on, if you have to focus on something, focus on where it's going to impact society the greatest. And in their minds and in their estimation of the system, that way is by um, saving lives and easing suffering. So, but there's a problem with sick care. The problem with sick care is that it is reactive. And who can type in the chat, just type in the chat, that what do we mean by reactive? What does reactive mean? We say that sick care is reactive. What do we mean by that? So I'll give you a quick second. Start typing away. By reactive, we mean that we are waiting until, or they wait until something has happened, and then we try to act after the fact. So if you have a series of possibilities, you wait until an eventuality occurs, and then you try to respond to that eventuality. That's what being reactive is. But if you want to have a chance of being optimally well, having, you know, achieved vitality, which is true wellness, true healthcare has to be more than just reactive. It has to be more proactive in its approach. And what do we mean by proactive? By proactive, we mean that we have to do something or make decisions or put in place an action in anticipation of what could go wrong. Oh, if the world were living like this, if we actually all lived this way, I think we'd have a much better existence. I think we'd have a lot fewer sick people. So in 2013, I went to a fish only diet lifestyle. It was supposed to be for 1 month, but I ended up doing that lifestyle until November of last year. And no, I didn't go back to eating chicken and beef and whatever else. I've actually graduated from just a fish only um, as my only source of meat, animal protein, to being a more vegan approach. And when I say vegan, it is I'm not a strict, when I say strict, but I'm not overly stringent with my vegan approach, because I do have ackee and saltfish, and we know saltfish is, fish. But I think that's about the only place that, I will have some animal protein is with ackee and saltfish. Or if somebody offers me a slice of cake and the cake might have eggs in it or it might have milk in it, um, you know, I'm not, but I only may have a piece of a slice. I couldn't when last I've had an actual full slice of a cake. But, we do what we need to do. But I made those choices because I want to increase and improve my health. Before something goes wrong, I want to make choices in my life, changes in my life, to prevent certain things from going wrong in the first place. And that is what a proactive lifestyle is about. But as we look at healthcare, our healthcare system is, I don't want to say it is in shambles, although it is in shambles. But there's a crisis right now, and the crisis is that um, the main reason for persons to seek medical help is not for emergency management. It's not even for um, traumas or some kind of a life-threatening situation that happened accidentally, or for some infection. The main reason that people seek doctors or seek intervention from the healthcare provider is because of some lifestyle disease that they developed. What are examples of lifestyle diseases? Hypertension, diabetes, stroke, um, let me see, there's one that I had in mind that I wanted to mention. I mean, there are a lot, um, but there are many, right? And these are the reasons people go to doctors. If we were to wait until we've developed diabetes to try to do something about it, would you agree that it will be much harder to treat? It'll be much harder to restore one to normal life. Obesity, thanks very much, Lorna. That's another very important one. And none of these things happen immediately. In other words, no one sits down at a dinner table with a plate of food, and after eating that one plate of food, now suddenly is obese, or now suddenly has high blood pressure, or suddenly has diabetes, or heart disease, or high cholesterol. These things happen with diligent effort over several years. You have to consistently do the wrong things for several years to get to that stage. And I'll say this to you now, in love, that if you have any of these conditions, it didn't happen by chance and it did not happen by accident. It happened because of choices that either you made for yourself or other people made on your behalf. And I'll just point out really quickly that when you look in the supermarkets, you will find that the majority of people in supermarkets are in the sections that have bagged produce, boxed produce, canned goods. These are the artificial, synthetic, processed areas of the supermarket. That's where we go. We need to start shopping in the produce section, the section that is produced by God, section that we get from the earth. So, and you will notice too that the produce section is the smallest section of the supermarket. Unless, of course, you happen to be in a country that may have the resources to have like a Whole Foods market. When I was in Texas, I used to go to a Whole Foods supermarket. There are different types, so it's not just the one that's brand named Whole Food, but there are different types of natural produce, organic markets or supermarkets, and in those places, almost shelf to shelf, the entire place is just produce of a wide variety, and typically they are organic in nature. If we live in this way, it is highly unlikely. I don't want to say impossible because there are different things that can cause problems, but it is highly unlikely that you will develop hypertension or develop diabetes or develop heart disease, high cholesterol, or any of those other maladies that affect the majority of the population. It's the choices that we make. It's the choices that we make. So let's continue, shall we? Because we can't solve a lifestyle problem with trying to spend more money on drugs and surgeries. But unfortunately, the way the system is set up, it's set up in a way that tries to promote the utilization of medication or a surgical procedure to fix something that is caused by a poor lifestyle. I know people have bariatric surgeries and they say bariatric surgery is the cure for obesity. And yes, if you can't eat enough food, what bariatric surgery is where they do a surgical procedure on your stomach to prevent you from being able to eat as much as you would once be able to eat. And because you can't eat as much food, the sheer amount of food that you eat will go down and you will lose weight. You will lose weight. Appetite and weight are closely associated with each other. And if you eat certain foods, they suppress your appetite and you will not want to eat as much. But if you eat certain other foods, they open up your appetite and make you want to eat more. So a lot of you persons who suffer with obesity and you love to eat and can't stop eating, or you can't think about living without eating as much as you do, it might not be because you have poor self-control. It might be because of the choices of foods that you've been eating have now put you in a place where you crave foods. And usually it's not craving wholesome foods, it's craving the same kind of toxic substances that we keep putting into our bodies. So we need to move away from that. We need to move away from that. Now, how can we successfully change our behavior to match that which is healthier for us? It's because you have to admit it's not easy. Many people go on New Year's resolutions, and as a result of the resolutions, they make the promises to themselves that they are going to stop eating certain things or eat a particular way or whatever the case is. And by February, right about now, they've forgotten their resolution and they're back to square one. We have to change our mindset if we want to change our behavior. We have to change the way we think if we want to change our behavior. We have to change our worldview, the way we view the world, if we want to change our behavior. And if you want to know which drives which change will drive which outcome, if you change the way you see your world, your behavior will automatically change. If you change your behavior without changing your worldview, your same worldview will eventually reconform your behavior back to its previous state. And so this is why a lot of people who go on these diets to lose weight, they will do it for a time, but then they will end up going back to their previous lifestyle because they didn't change their mindset. They didn't change the way they think. So I've put together a couple slides to help you understand the differences in the way people think. And if you can think in the column on the right, which is the wellness column, as opposed to the illness column, if you can think according to the wellness column, you will have a much better chance of being healthy. So are you ready? I hope you're ready. Because it's simple, it's cool. So let's look at it real quick. Um, if you listen to any drug ad on TV, they will tell you if you have a problem, if you have a headache, what do you want to take to feel better is kind of how they push you into thinking. So much so that as soon as somebody has a headache, their first thought is, what can I take to feel better? They're not even asking the question, what's causing the headache. They don't even, most people don't ask that question anymore because we have been conditioned to ask a different question. What can I take to feel better? And it is conditioning. We have been trained in this way, and we're trained by the pharmaceutical industry, really. Now, the unfortunate reality is that the pharmaceutical industry is the industry that is largely responsible for much of the misinformation about health. And I say misinformation about health because health does not come from a pill or a potion or a lotion. Health comes from inside out, not from outside in. But they have to tell us or train us in that way because if we thought in the way that it actually is, then we will not use or utilize their products or services as much as we do. And one of the number one killers of people in the world, especially in developed countries, is the use of pharmaceutical medication. The more medications you are on, the sicker you will be. And it's a vicious cycle because the sicker you get, the more medication that you're tempted to go on. So we want to try to see if we can improve the way we think, right? So rather than saying, if I have a headache, what can I take to feel better? What if you ask this question instead? What do I need to do in order to get better? If you have a headache, you ask, what can I do to get better? In other words, what can I do to restore myself to normal function? Then you will you will approach it a little bit differently because you won't simply be looking for the thing that's going to knock out the headache without necessarily restoring something that has gone wrong in your system to cause the headaches in the first place. You want to dig a little deeper. And so that's what we do. The second thing is we treat wellness as if it's a destination, somewhere to achieve or something to achieve or somewhere to get to. So we say, boy, I wish I had perfect health. I don't ask that question anymore because I understand that wellness is not a destination. Wellness, my dear friends, is a journey. You see, the journey of wellness is is what is important. It is whether you are on that journey or not. It is not whether you have gotten to that destination or not. It's whether you're on the wellness path. And so it is what you're doing on an ongoing basis, not for a short while, to achieve it. So rather than simply saying you want to get well, ask the question, what do I need to do in order to stay well? Because it's a series of choices you have to make over and over again to achieve it. And how long we live is the way that a lot of people view the success of the current system in which we live and operate. In other words, if we say that we have more persons who are living to be 100 years old now, we will say that that means the healthcare system is doing very well. When you look at the quality of person's life, the quality of someone's life, is in no means or by no means indicated by how long they live. Because somebody can have excellent quality of life and die at 70, and someone can have a poor quality of life and die at 80. My question to you is, which would you rather be? Would you rather be the person who has an excellent quality of life but only lives to be 70 years old, or somebody who had a poor quality of life and living to be 80 years old? I know my answer. My answer is simple. What would your answer be? Go ahead and write that in the comments. Write that in the comments. Um, over there to my left. Because I want to tell you what mine is too, but I want to see what yours is. So rather than simply saying you want to stay alive, how about what do I need to do in order to feel alive? Because it's life, the quality of that life is what you're interested in. At least that's what I'm interested in, right? So what's the simple shift for me? According to the illness care model, people want to feel better, get well, and stay alive. But I would suggest to you that a more appropriate mindset to achieve wellness is, rather than wanting to feel better, you ask, what do I need to do to get better? And you do go through a series of steps, a strategy really, in order for you to stay well and ensure, above all things, that you have a quality of life so that you're not only being alive, but you're feeling alive. And so instead of feel, get, stay, it is get, stay, feel. A very subtle shift in the way we think. Continuing now, and the rest of it is going to go a lot faster. The second key is the truth about pain. Is pain a good thing or a bad thing? And there are people who will argue one side or the other, but there are good parts of pain, I suppose, and there are bad components of pain, I suppose. What you might think the bad part of pain is, I might not agree, but either way, we do all agree that pain will have some good things associated and some bad things. But one thing we do know is that there are limitations to pain. But what is the purpose of pain? The purpose of pain is to let us know when something has gone wrong, right? It alerts us. It's one of our many alarm systems in the body to tell us that something has gone wrong. And this alarm system, we will find that it is easily silenced and often silenced and ignored. Just because you have pain doesn't mean that the person is going to act on that pain. That's the first limitation of pain. But the next limitation of pain is that you can't simply trust pain because pain doesn't always warn you. Pain doesn't always tell you that something has gone wrong. Good health means or does not mean that you feel good. Or feeling good does not mean you're having good health. Because many persons have excellent health, but they feel not so great sometimes. And then you have other persons who have terrible health, but they feel fine. You see, there are examples like cancer. Most cancers do not cause pain initially or immediately. And so you might be going through life fit as a fiddle, healthy as a horse, as you would say, come down with cancer and not realize that you have cancer for several years until it has gotten to a stage where it is now identifiable on an exam or by a diagnostic test. And by that time, it's already in an advanced stage. There's no cancer that is caught early. Cancers are caught earlier in some circumstances than later, but once you can identify the cancer, it's no longer early. Because cancer takes several years to develop to a point where it can even be identified by the most sensitive tests that we have. So by the time you can test and find the cancer, it's already advanced. It might not have spread elsewhere, but it's already advanced. So we can't simply wait until pain alerts us. We have to make choices like I've made choices right now to ensure that you have a greater probability of achieving optimal health and vitality. That's what it's about. So if you want to know if you're having good health, you have to make sure that you do the things necessary to ensure good healthy function. And function of what? We're talking about the different systems of the body. And we need to trust the function of our body, the function of the different systems, and not just how we feel. The number one reason we get sick is because the reasons we get sick is because we either fail to do something or take something, or eat something that our body needs, or we are putting something into our bodies that our bodies will reject. So it's either a nutrient, something that our body needs that we're not giving it, or a toxin, something that our bodies are not supposed to be in our bodies that we are putting in. If we maximize our nutrients and minimize our toxins, we are shifting the balance of health and vitality. And there are certain things that will affect certain systems. But I just wanted to point that out. Next thing is the different systems of the body includes some of the following. The immune system, the digestive system, cardiovascular, integumentary, which is the skin and coverings, our respiratory system, endocrine, reproductive, excretory, musculoskeletal, and the nervous system. And I'm going to ask a very serious question. And no, there's no system that's more important than any of the others. Because you cannot live unless every one of these systems are working. even our reproductive systems, because that reproductive system secretes some specific hormones for health. And so we want to make sure that that system is working properly. So we can't simply say that a system is more important than another, but what we do know is that there is one system that is considered to be the master control system of all the other systems. And it's considered to be the master control system because this system governs and regulates the function of every other system. Who will venture a guess as to which system that would be? I think Nadine was here before, so if Nadine, if you were here before, I don't want you to be answering. Let one of the newbies answer. So which system is considered to be the master control system of the body? Because that system governs and controls or governs and regulates the function of all the other systems. Lorna, you go to the head of the class. The nervous system is the master control system of the body. The nervous system is the master control system of the body. And what does that mean? It means simply that the nervous system is what is responsible for each of the systems operating the way they are supposed to. So watch carefully. If you look at the brain, which is up here, and the spinal cord, that's a part of what we call the central nervous system. It is from the central nervous system that all the nerves will go to the rest of the body to control the various organs in the body. Now I'm going to show you very quickly. If you look at the heart, for example, the heart has a yellow band and a blue band that goes to it. And of course, it's not those colors in the body. We just do this for illustration. These are nerves. The blue band comes from somewhere up off the brain stem. The yellow band comes from the spine. That yellow band that comes from the spine is what we call a part of our fight and flight system. That's our sympathetic system. That causes our heart rate to speed up. Whereas the blue nerve that's coming from the brainstem is a part of the rest and digest system, which is the recovery system, which we call the parasympathetic system. That will cause the heart to slow down. This principle of how this particular part of your nervous system interacts with the different organs is consistent, meaning that every single organ that you see listed here, every single one of them will have a blue band and a yellow band that goes to it. A blue band and a yellow band. Blue band, yellow band, blue band, yellow band, blue and yellow for the heart, blue and yellow for the lungs. Now, how does our nervous system control? How does our nervous system control the different organs? Under one circumstance, it will cause our organ system to speed up. And on another circumstance, it will cause it to slow down. If a gunman comes into the room, your heart rate will pick up and so on. If somebody comes into the room that you hate, it will cause a different set of changes. If someone comes into the room that you love, it will cause a different set of changes. If you see an image of something that frightens you, you'll have a different set of changes. And if you look at an image of something that is um, peaceful or tranquil, you have a different set of responses. Our nervous system is the master control system. And we'll see that Dane Allen says that the worst pain is a pinched nerve pain. I've had a pinched nerve pain, so I know that is not far from being true. Boy, I tell you, I understand that one. Anyhow, let's continue. Let's rock and roll. Now, spinal misalignments are called vertebral subluxations. Spinal misalignments are called vertebral subluxations. And because the nerves exit between the bones of the spine, if you have a subluxation in the spine, it can interfere with the proper function of the nerves. That is something that's very important to know. And so you may have wondered why it is that a chiropractor is going to go through the trouble to realign the spine. Why are we really realigning the spine? To what effect? And we do this because we understand that the nerves travel between the bones of the spine. And if your spine is out of alignment, it may impact or interfere with, directly or indirectly, the proper function of the nerves. As Dane said, may cause a pinched nerve, which we know can be painful. It doesn't have to be, but it can be painful. So when we look at this diagram here, we can see a few things that we point out. This middle hole, that hole there where the laser pointer is at, that hole is the opening between the bones that allow the nerves to exit. Exit the spine, that is. So you'll see this yellow band here, this red band, this yellow one. These are all nerves exiting between the opening. But if you look at the third vertebra or the third bone, that's the middle bone here, you'll notice that it's not lined up with the others. It has been displaced backwards. And so because it's been displaced backwards, it is causing the hole that is in the back of it to close off. And so the nerve that travels in that space may become impeded directly by the compression of the nerves, by the bones, or by the cartilage or the discs. These are things that will cause a pinched nerve. But sometimes just having the bone out of place like that can cause local irritation in the area, which we call inflammation. And inflammation secretes chemicals that are toxic to nerve tissue. And these inflammatory chemicals, they themselves can interfere with the nerves and cause, whether it is pain, discomfort, or dysfunction of the nerve, even without compression. This is something that many people are unaware of. So this is an important point. Now I'm going to go through the next set just a little bit quicker because I want to really get to the end point here, the crescendo, and to say that subluxations are caused by stress. But stress can exist in different ways. And when we say subluxation, we're simply saying dis-ease or poor functioning of the system. And so when we look at that system, we will understand that the physical, biochemical, and psychological aspects of stress all can play a role. Physical stress, like a car accident or a fall, is one such stress. Biochemical stresses are things like things that we put into our bodies, things that we eat, things that we drink, of that nature. These are things that are also important, as well as psychological stresses. How we feel about ourselves, how we feel about our environment, whether we are in a loving relationship, whether we are at a job that we like or we hate. These things will impact our health. And so if you are in a job that you hate and you go home to a relationship that you have not been able to cultivate healthily, and so the relationship is has soured, and so you're going through stress at work, you come home to find stress with your loved one, your partner, you may have children that are causing stress, and everywhere you turn you are hitting up against stress. That situation is a situation that too many people find themselves in. And because they're in that situation, it ends up costing persons their health and their lives. Because these things are the things that will cause or will allow cancer to breed or to proliferate, infections to proliferate, different types of diseases to proliferate. The Bible even speaks to it and says, a joyful heart is good medicine, but a broken spirit dries up the bones. Now, obviously, while you're alive, your bones won't go dry. It is when you're dead that your bones will go dry. So, a broken spirit is not that it makes your bones dry, is that it can lead to your demise. Whereas there is healing in a joyful heart. And so I have decided to live my life. And if you've seen me, you will know that I live my life according to a joyful heart, not a broken spirit. And so when people have broken spirits, we need to encourage them because it leads to their demise, it leads to death. And that is biblical. Okay, let us continue, shall we? Let us continue. Oh, by the way, just to say this last point, that the healthier our nervous system is the better able we are to adapt or cope with our environmental stresses. I'm going to skip over the next slide. Kind of a technical slide, takes a little while to explain. But chiropractic is one of those tools that will improve nervous system function. We use an analogy called a gap analogy to say the wider our gap is the wider our ability to adapt. So the more we can adapt to our environment, the healthier we are. Chiropractic is one of the tools that can be used to increase our adaptive potential. But it is not the only essential tool, it's not the only required tool. There are many tools that are essential and required. So if you go to your chiropractor and you are adjusted, and then you go to your home and you eat garbage, I won't pick on any food types, but you eat poorly, and you're in one of those high stressed environments, do not expect that you're going to be experiencing or manifesting good health. Do not expect that the adjustment is going to be as effective for you. So if you are a patient, whether you're a patient of mine or somebody else, whether chiropractic or otherwise, and you're being treated, but you find that your illness persists, you have to find out whether your environment is toxic or healing. Is your environment toxic or is it healing? Very important point. And for those of you who might be joining us now, you don't have to start where I am right now you can actually rewind the video to the beginning, advance it to when I start talking, of course, and you can watch it from the beginning, all right, and just follow through that way. So in case there's anything that you've missed, you would be able to catch up because we're almost at the end. At our office, we our focus is twofold, is several fold, but we want to be able to identify within the spine of the individual any kind of dysfunction that could impair or impact the proper working of the nervous system. And so we've invested in technology to help us to identify subluxations whenever and wherever they happen. This first piece here is our rolling thermal scan, which we use to measure the skin temperature. That's the temperature of the skin on either side of the spine. On this side here is called our surface EMG, which is our a device that can be used to measure the electrical activity within the muscles of the spine. So it gives us a clue as to whether there is muscle tension, muscle weakness, whether there are any spasms, anything like that going on in the spine, or whether there is heat on one side of the spine or imbalances in the distribution of temperature on each side of the spine. Very important. This helps us to identify subluxations in the spine. Now, quick question. What kind of doctor is a chiropractor? Many people wonder what kind of a doctor a chiropractor is. And so I'm going to try to use this test to kind of show what kind of a doctor a chiropractor is. So this lady was asked to wiggle her left ankle. And when she was asked to wiggle the left ankle, they took a picture of her brain to show what the results were. Before she received her adjustment, the image on the left represents that brain, and you see lots of areas of lights all over the brain. This is showing that the brain is doing a lot of processing just to do that one task. After she got her adjustment, the same person, and the adjustment was a chiropractic alignment of a vertebra in the neck, at the top of the neck. She was asked to repeat the task, and this is what you saw as areas of light. Fewer areas. In fact, it corresponded with the right side of the brain. This is the right side. This is the left side of the brain, right? And so we saw activity in that left side of the brain. Fewer areas of involvement existed in the person after the adjustment when compared to before. So what we do see with this is that the person's brain function their brain function is certainly more efficient after the adjustment. And that is an important point. So when people ask, what kind of a doctor is a chiropractor? You can help them to answer that chiropractors are not bone doctors. We're nervous system doctors. Why is that so? We're nervous system doctors because the work that we do impacts the nervous system far more than it impacts the bones. Now, I'm a specialist within the field of chiropractic. I have a diploma in chiropractic neurology. And what does that mean for the profession of chiropractic? Chiropractors realign the spine. We are all trained to realign the spine. But the chiropractic neurologist has specialized training that allows us to retrain the brain itself. So they adjust, the chiropractor will realign the spine, but the chiropractic neurologist can also retrain the brain. And now we do this by using specific exercises, rehabilitation tools, equipment, eye movements, different sensations, smells, touch, taste, to try to achieve what we want to achieve, right? And so this is what we do as a chiropractic neurologist. And these are some of the conditions that, as a chiropractic neurologist, I personally have treated, with varying degrees of success, if you want to deem success as whether the persons go back to normal. Um, for some of these things, there's no normal to get to, per se. But improvement in function is what we try to go for. And so if we can achieve improvement in function, then we know we are improving the person's quality of life. And that's what we can ask for. At Gardner Chiropractic, we have some visions here. Our vision is to identify subluxations wherever and whenever they happen, to provide a program of chiropractic care. And when we talk about a program of chiropractic care at our office, for the most part, we work in 12 visit cycles. So a phase of care is typically 12 visits long. At the end of that, we do a re-examination so we can compare the initial exam to what it will be like after um, they have done their 12 treatments. The 12 treatments may happen at over different durations depending on how frequently we are seeing that person. So if it's twice a week, we'll be done in 6 weeks. If it's once a week, we'll be done in 12 weeks. If it's every other week, we'll be done in 6 months. So that kind of a thing. Now, whose responsibility is it to ensure your health and well-being? Clearly, it is our own responsibility for our health and well-being. But what about those of our children and those who are, we are responsible for? Well, if we make poor choices or if we are poorly informed, then we are more likely to make poor choices for our children as well. And so it's important to me that our patients have good information, a good mindset, so they can help to ensure not just the safety, but the health of their children or whoever they are responsible for. Sometimes you're responsible for your parents. You're an adult who is responsible for your adult parents, your senior parents. And so we have to make wise choices. We have our testimonial page, and I'm going to invite you to, since you're on our YouTube page, our YouTube channel, to go to our playlist where we have testimonials and just look through some of those testimonials. Some of them are very cool. Um, and yeah, this one is one of my favorite ones, the one with Joy. So you can look up that one as well. And you can find this on our channel. So, if you have not yet done so, I'm going to encourage you to please indicate your name, so that we will know that you have joined us. Please indicate your name. That is provided that you are, interested in this. If you're not an actual patient, nor are you interested in becoming a patient here. You just want to make sure that you just found us, happen to find us, and you want to make some comments. Feel free to comment. We welcome all comments. And at the end of the presentation, I promise to just stay back a couple of minutes to answer any questions that you may have. So, there's a special offer for anyone who is not already a patient of ours who would like to get an appointment made. And I have to admit that the downside to how our office is organized is that it is a long wait to get an appointment. And it's unfortunate how it is. My hope is that I will be able to get an associate to help so that we can cut back this wait time. So that is my hope. So, for those of you who are not yet patients and you would like to make an appointment to come in to be examined, I mean, you've listened to the presentation, you've recognized that you've probably been living your life based on presence of pain or absence of pain, and you use that to inform what you do and when you do it. Obviously, my encouragement to you is that you cease living in that way because it's too easy to take advantage of people who live in that way. So, if you're not a patient and you would like to take advantage of this offer, it is a 40% discount that you will receive off the new patient examination by simply sending an email to appointments@gcnjamaica.com. Send an email to appointments@gcnjamaica.com, and someone will be able to assist you in getting this appointment set up. That's if you would like to do that, right? If you're in Jamaica, obviously, it will be a big plus. If you're not in Jamaica, then you'll have to come here if you want me to take a look at you. Otherwise, you can go visit your neighborhood chiropractors. So we have that special offer. Now for our existing patients, and it's for our existing patients that the register becomes important. Because if your name is not listed in the chat, we will not know whether you have watched us or participated to be able to get the benefits that we're offering next. So, what are the benefits? All of our existing patients will receive a 20% discount off their update examination. And the update exam is almost the same cost of the new exam, so it's 20% of that amount. You will get a 20% discount off one treatment per person that you refer. So if you refer one person, you get a 20% discount off one treatment. If you referred two people, you get a 20% discount off two treatments, or you can get two 20% discounts off one treatment. So you can do it however you want to, you can mix it however you want to mix it, because some people, they may invite 5 people, for example, and that would entitle them to either 5 20% discounts, which is the same as a free treatment. So they could take it by doing one 20% discount off each treatment for 5 treatments, or just get one free treatment. So these are things that we offer. And the last thing is you'll get a 10% discount off the entire next phase of care, We've already indicated that a phase of care is 12 treatments. And so a 10% discount off your entire next phase of care will be 10% off your 12 treatments plus the 10% off your update examination at the end or update scan at the end. And so these are things that we offer for all of our existing patients. You will notice that our existing patients make a lot more. The existing patients will make a lot more, will get a lot more, and that's because, you know, I want to make sure that I show love to my existing patients who have shown love to me. But you new patients, you new people, you're yet to show your love. So how can I be giving you more? It's like I have my own child, but I'm not giving my child lunch money so that I can give a beggar on the street more money. Nuh-uh. I don't believe in that principle. I take care of my family before I take care of my neighbors. That's the principle I believe in. And so I hope that doesn't rub you the wrong way, but you know, that only makes sense. It's like when you're on the airplane, it says, make sure you put on your mask first before you try to help others. And the reason that we do that is simple. If you have somebody who is relying on you, like your child, and there's an emergency like a plane crash, and you both survived, your child has a much higher likelihood of being taken care of if you are also alive. But if something happened to you and it's just your child, depending on the age of the child, in an emergency situation, nobody else might look out for your child the way you will. So you need to make sure that you take care of yourself first, and then you can take care of anyone else around you. And that is why I ensure that I've been trying to get better rest. I'm ensuring that my nutrition is on point because, and I'm exercising. I mean, I exercise pretty rigorously because I want to make sure that I am around to help take care of you guys. I can't take care of you first and then I end up dying of a heart attack because I didn't take care of my nutrition. I can't take care of you and then I end up suffering some cardiovascular issue because I wasn't taking care of my health. I have to take care of my health first. So those are the offers. Now, finally, for as we close off, I want to just point out a couple things here. Now, if you notice that there are some links here, obviously these are not clickable links for you because this is on my video, but I wonder if I could, I'm going to try to see if I can copy them and paste them in the chat. That will probably be of help. Excellent. Oh, that's not excellent. There is no space. So I'm going to do that again and make sure. Come on. Oh, it's not allowing me to do this. So hold on. Let me do something here, people. I'll enter them 1-1. The first one is our website, gcnjamaica.com. Our Facebook page is GCN Jamaica. Our Facebook or YouTube channel is youtube.com/user/Gardner Chiropractic. And we also have a radio program every Tuesday night at 8 p.m. Jamaica time. This radio program is a live program, and it is a very interesting program. We talk about various health topics. Last week, or this past week here, this week, we spoke about congenital heart disease, and that was awesome. Last week, we talked about cataracts, and so we talk about different things, not just chiropractic things. And so hopefully that's something that will be of benefit to you. Nonetheless, um, we want to make sure that you are all taking good care of yourselves and making wise choices, because people suffer because of bad choices that we make. I don't want that to be your lot. So I will stick around a little bit to answer any questions for anyone on the chat. But thank you so much for joining us. I hope you learned something. I hope it was meaningful. I hope it was instructive. And I sincerely hope that you will subscribe to our channel. If you haven't already done so, click the subscribe icon, and also the bell icon to ensure that whenever we are live, that you are able to see us. And I just want to point out as well that in this year, I have promised that I'm going to do some movie with the doc, which is some shows that I'm going to showcase here. Um, so watch out for that. It will be every fifth Thursday of the month, every fifth Thursday. This patient health workshop class is held every first Thursday and every third Thursday. That is not a public holiday, right? But every fifth Thursday of the month, we will have our movie with the doc, which is a special film or documentary or whatever it is that I'm going to showcase. That is what I think is, it has to be interesting, right? So I'm going to look for the most interesting things to share and things that are very thought provoking. And we'll probably spend about a half an hour afterwards just talking about it and answering questions, right? Because this year we have to start protecting our people, because I think we're being taken advantage of in many ways because of bad information, and we don't. I think enough is enough. It's time to make sure that people have good information that we can really rally around. So yeah, so that is that. I wish for you all the very best tonight, and may God bless and keep you. And we shall see you when we see you. If you have any questions, please feel free to jot them down in the comment section, and I'll try my best to answer them. So God bless you and have a good night. All right, so any questions, anyone?
I forgive the pain you gave to me so long ago. Sleepless nights I laid awake just begging to let go. I almost got to suicidal thoughts, but you stepped in. An angel sent from heaven showed me how to live again. Now I'm falling and I can't see the ground. Can we stop this gravity? It keeps bringing me down. I can't breathe and I don't wanna die. Can we stop this gravity? 'Cause I don't wanna say goodbye. My love, I'm gone. I need to be strong. The darkness had tried to swallow me. Spoons are full, but I hear your call. I pray I don't hit the ground. Gravity.